Today we're going to cut the intros a little short. Dr. Williams is going to, many times we've had Dr. Williams on the show and talked about his process, but we haven't actually seen it at work. So I'm going to be a patient for him today, and we'll demonstrate a little bit of how this works. So thanks, Dr. Williams. It's up to you. Take it away.
All right, Lou. So as we've talked about before, I practice a very specialized advanced form of chiropractic called the bioenergetic synchronization technique. It's within what's called the Mortar Health System that was developed by Dr. M.T. Mortar Jr. about 30 years ago, and it's been in development. And so what this differs from traditional chiropractic is that most of the time, if you've been a chiropractic patient or a chiropractor, you know that you can get a good adjustment or give a good adjustment, but it doesn't seem to last. So we know that the vertebra keeps going out of position, and the old way of thinking was just keep doing it and give the patient relief. But that never felt really good to me because it felt like we weren't really getting to the causes. Mm-hmm. So you could say the vertebral position is cause of the pain or symptoms, but what is causing it?
I see.
So that is the whole process, is of identifying what is interfering with the body's ability to repair itself. Because it's designed to do that. No one ever had to teach you how to repair a cut in your finger. The body has an innate wisdom to do that. So what we do is look at what is interfering with that process. So we've been talking a lot about that in the previous shows. The main things are excessive stresses that are physical, chemical, and mental emotional. So we're going to assess today how your body has been compromised by excessive stress and how it's gotten stuck rather than being able to adapt to your present physical environment. Because that's what we're designed to do, is adapt. If we don't adapt, we're dying, in a way of speaking. So what is going to allow your nervous system, which is the communication system of the body, to recognize what is going on right now and respond to it? Or is it responding to a past experience and giving the body an input that's causing it to respond to back then when it's supposed to be going right now, and that creates this problem and usually leads to some sort of injury or dysfunction.
Okay.
So let's have you stand, and we're going to go over here and just look at Lou's posture and do a little bit of an evaluation. So let's have you turn this way, Lou. So Lou has told me that he has had some chronic back pain over the years. It comes and goes. So as I looked at Lou, I looked at the level of his head, and you can see that the head is high on the right. As we look at his shoulders high on the left. And when I check Lou's hips, he's high on the right. So he's got this torquing going on. He's not balanced. He's not even. And as I palpate his back, I'm going to start with his spine, and we're going to go down low in here. And Lou, let me know if there's any tenderness.
Yeah, right there.
There, and here.
All along there, yeah.
And here.
Uh-huh, sure.
How about here?
Yep.
And here?
No,
so it's less. So all these lumbar vertebrae, the lower back vertebrae, are tender. And as I go up through here, feels pretty good till about right there, right? That dips in a little bit. And as I go on up again, not too bad through here.
No.
Tilt your head a little bit. And there's probably something as I go up into his neck again.
Yep.
And then a little bit in there?
Yes.
How about in here?
Yes.
More here?
Yeah, more on that
More
side.
on that left. So as we feel the muscles of Lou's back now, the other thing that's very significant with Lou is the left side of his back is very relaxed. Now, Lou, how does it feel when I get over in there?
Tension.
Way tight. So his left and right sides are completely different. That would be appropriate physiology if he was bent over, twisting and lifting something. But standing up, that's inappropriate. We call it a timing problem because the body's obviously designed to have tension on that side, but when he's standing, it's unnecessary. The other thing that we found with Lou is, if you turn towards me, Lou, and I'll get over here, we noticed that when Lou leans back, very little moving backwards. If he moves forward, he's got pretty good range of motion. So that's one of the most significant things that we saw. And when let's go forward again, when he leans one way, pretty restricted.
Really restricted.
Really restricted. And so when he twists pretty easily that way, a little restricted this way.
That's right.
So let's have you go sideways again, and let's check his neck. Bend forward. He's got pretty good motion forward. Now come back up, lean the head back, and he's very restricted when he leans his head back. And let's have you go ahead and face the camera again. turn and look over this shoulder and this and this other shoulder. Go that way.
All right, sorry.
And back to center. Good. So we see a little restriction. Lean this way and back this way. And you can feel it's pretty restricted going this way, right, Lou?
Yeah.
When you go this way, a little bit better, but still pretty
restricted.
And you've had some injuries in the past, like many of us. We lived very intensely
I've
in
had some
sports and such.
motorcycle accidents, martial arts injuries, and those sorts of things.
Absolutely. So we see some restrictions and imbalance in his musculature. And so something's going on that's now allowing him to adapt. Something has interfered with his body to be resilient.
That's right.
You know, because when we were kids, we were resilient. We bounce back. As we get to be older, we don't bounce back so well. You know, it reminds me of that old saying, I've fallen and I can't get up.
Yeah, right, exactly. Exactly.
Go ahead and lay back on your back, Lou. So we're going to go further into checking Lou's body balance here. And hopefully we won't. So Lou, what I'm going to do, you're familiar with muscle testing, correct?
Yes.
So we're going to do a simple muscle test with Lou to determine, is the nervous system, is there a connection that's intact, or is there a circuit that has blown because there's been excessive stress?
Okay.
Okay? So I'm going to have you keep your arm right here, wrist relaxed, keep your shoulder against the table, and I want you to hold right there. That's nice and strong. And close your eyes. Good. Arm down. We check with the eyes open and closed to check conscious and subconscious input. They should be congruent.
Okay.
Okay. This arm up. Wrist relaxed. Hold here. Push back at me. Eyes closed. Good. So we see that Lou's upper body is working quite well. Let's go back down to the lower body. And you're not going to be able to see this, but go ahead and relax your legs, Lou. When I look down at Lou's legs, his right leg is about that much longer than the left. So there's a great deal of imbalance there. The muscles are pulling unevenly on that pelvis. Now I'm going to turn your legs in and out, Lou. I don't know if you can see this, but his leg turns in pretty well. As I turn in this right leg, can you feel that, Lou?
Yeah, it's restricted.
It doesn't move in easily. In fact, you can see as I hold that there that that's very, very different. So we're going to evaluate and see what is causing this imbalance. It could be excessive physical stress. In that case, we will be treating him face down. I call it a body memory update. If not, it could be that the brain is stuck on some past experience and it keeps expressing itself in the body. The body's receiving the messages perfectly, but it's not appropriate for right now. Does that make sense, Lou?
Yes.
Okay. So we call that adjustment, which we've done in a face-up position, a mind memory update. So Lou, we're going to use your mind to key in, because the mind is what directs the nervous system. Okay?
Okay.
So I'm going to have you think, put your attention, put your focus on your lower back. And let me know when you have that.
I do.
Okay. So when Lou does that, his legs even up. And you feel how that leg turns right in now, Lou?
Yes.
It loosened right up. And if I go back up to the upper body, keep thinking of the lower back and hold. And this arm that was previously strong is weak. And I'm not pushing any harder, correct, Lou?
That's correct.
In fact, I could probably push it over with one finger at that point.
Wow.
So we call that a reactive thought. What that does is confirm that there is some pattern held in his nervous system that is connected to this problem, is leading us to the cause of what causes this recurring thing. Because you don't have this all the time, right, Lou?
That's right.
It comes and goes.
Yes.
Okay. So Lou, we are going to start with you in the face-up position. This pattern is held in your high brain, and it keeps reflecting whenever you encounter certain feelings and certain experiences, certain sensations. So Lou, I want you to remember when this first started.
The back injury?
Yes.
Okay.
And tell me a little bit about what happened.
I was practicing an exercise from my martial arts group called a meso jump. It's like a squat jump. Your hands behind your back and you push off the ground and then come back into squat position and keep jumping. Okay. And I was jumping down a beach. The beach was unlevel. uneven, and I did a couple of extra ones just to push myself beyond what I normally would do, and the third one, my back popped.
Okay, so there was a physical injury here. The body is designed to heal a physical injury. As we've talked about before, no one has ever had to teach you how to heal a cut in your finger. There's an innate wisdom that we're born with to do that. So certainly there was an injury. Why has it caused a recurring problem from that time on is the big question. Okay? So I want you to think about that experience. Okay. So that stays the same there. It tells us, yes, we're on the right track. So what we have found is that usually there is something going on in a person's life around the time that they have a physical injury that's locked in an emotional response. And now those two are connected. And the subconscious mind, which runs your body, is not designed to heal an emotional or a mental injury. It's designed to heal physical injury. It's designed to allow you to operate in a physical universe.
So you mean that there was some kind of mental trauma occurred at the same time?
There could have been, and that's what I want to ask you right now. What was going on in your life? And you don't have to tell me. If you want to, you certainly can. But you can just think it, because that's what we want, is to evaluate your thoughts. I want you to think about what was going on in your life around that time or prior to or around that time that you had that injury.
Okay.
You got it?
Yeah.
So when I go back, that still stays the same, meaning it's stayed relaxed, the same reaction, hold here. So it tells me that this experience is linked up with your back pain, with your injury. And most of the time what happens is you'll go to a doctor and they'll just deal with the physical aspect. But even D.D. Palmer, the originator of chiropractic back in 1895, said the three causes of any condition are traumatism, poison, and autosuggestion. Dr. Mortar updated that language to trauma, toxicity, and thoughts, which lead to what we call a timing problem. So Lou, your subconscious mind is different than your conscious mind. Your subconscious mind stores memories as pictures and feelings.